I was looking at how accurately can ChatGPT actually answer nursing questions. I was curious if it can have the ability, or if it has the ability to pass the NCLEX. And I can tell you without a doubt, it can for sure pass the NCLEX. It does get confused on some questions. One of the questions that I asked it with multiple choice answers was, why do you give morphine to patients that are having an MI? And some of the multiple choice that I gave to it was for anxiety, for pain, for sedation, or to decrease oxygen demand. And the answer that it gave me was that you give morphine to a patient with MI to treat the patient's pain. But this, however, if you're taking the NCLEX or any kind of nursing exam, the correct answer is to decrease the oxygen demand, because what morphine does, is it lowers blood pressure, it lowers your heart rate, it lowers that cardiac oxygen demand. So it got that one incorrect, and it gets those confusing ones wrong sometimes, but I want to say about 70% of the time, 80% of the time, it gets those confusing ones correct. But what's nice about that is it gives you rationales for why it chose that answer. So if you're not sure, or if it gets it wrong, you can ask it, for example, why do we give morphine to lower oxygen demand, or how does morphine lower oxygen demand? And it gives you these amazing responses. So if I'm a nursing student out there, I would be using ChatGPT for giving me rationales, because we have one professor for each class, you could say. Some professors teach multiple classes, but you're only getting that one teaching style. And sometimes how that professor teaches just doesn't always work with us, and it's a little bit harder for us to memorize things or learn things. Or sometimes we don't get the right explanation, or it's not said in the right way. What ChatGPT does, it's able to elaborate on these rationales and give you multiple different rationales on why this is the right answer or how this works. So this is a very useful teaching tool, even for nurses out there. If you're confused on why we give statins to lower cholesterol, or why do we give this dose of metoprolol versus this dose, it gives you those answers. Or why do we prefer not to give ACE inhibitors to African American population? It gives you those answers. So it's not only useful for nursing students, it's very helpful for any kind of nursing question out there. If you're on a unit and trying to figure out, why did the doctor prescribe this, and you're looking through the pharmacopoeia or your unit's program for the pharmaceutical information, you can just pop in ChatGPT and it can give you a well drawn out answer with almost pinpoint accuracy.